Hello friends, welcome to my new video about the reasoning questions of the blood. Now let us start. Nutritional hemosiderosis caused by excessive consumption of red wine. Why? So nutritional hemosiderosis occurs due to excessive intake of iron, and it is sometimes caused by excessive consumption of red wine that has very high iron content, and because alcohol increases the absorption of the iron. So that nutritional hemosiderosis caused by excessive consumption of the red wine. Deficiency of anti-hemophilic factor. Factor 8 that leads to classical hemophilia. Why? So it is caused by abnormality or deficiency of factor 8, and it is an inherited sex-linked anomaly due to an abnormal gene on X chromosome, and it is invariably transmitted by female to male who manifest signs of disease, and the gene responsible for the hemophilia that is present in X chromosome. Now in the presence of the another normal X chromosome, the gene acts as a recessive. For example, the individual has no sign of hemophilia but can transmit the disease, and certain constituents of the normal X chromosome may be responsible for this. Hemophilia is usually affects the male. So answer is, what is the hemophilia? So hemophilia is a group of sex-linked inherited blood disorder characterized by prolonged clotting time due to deficiency of clotting factor 8 and 9. And the gene responsible for the hemophilia is present on X chromosome, so that it is very common in male, and in female if the gene responsible for hemophilia is present on one X chromosome, she may be a carrier of hemophilia. If the hemophilic man marries a hemophilic carrier, it is possible to have a female hemophilic child, but this occurrence is very rare. Blood clotting is abnormal in an individual with a vitamin K deficiency. So vitamin K is required for the synthesis of prothrombin, means factor 2 and factor 7, 9 and 10 in the liver. Vitamin K in the liver acts on certain receptor sites to form all the clotting factors. So the deficiency of the vitamin K lead to decrease or no formation of the clotting factors, and all these clotting factors are essential for the coagulation of the blood, so that the blood clotting is abnormal in an individual with the vitamin K deficiency. Human tissue plasminogen activator used clinically in the treatment of early myocardial infarction. Because human tissue plasminogen activator activates fibrinolytic system, and fibrinolytic system responsible for the lysis of the clot, so that human tissue plasminogen activator used clinically in the treatment of early myocardial infarction. Platelets play an important role in the clot retraction. Now, contractile proteins include actin, myosin, and thrombostatin. Actin and myosin molecules are similar to those of contractile proteins of the muscles. So, contractile proteins can cause the platelets to contract and responsible for clot retraction. ABO antibodies are known as cold antibodies. Why? Because they are act best at low temperature between 5 degrees centigrade to 20 degrees centigrade, so that they are known as cold antibodies. RH antibodies are known as warm antibodies. Why? Because the RH antibodies are of IgG type, an antigen-antibody reaction that occurs based at the body temperature. Therefore, the Rh antibody are known as warm antibody. ABO incompatibilities rarely produce hemolytic disease of newborn. Why? So, ABO antibody means alpha and beta antibodies. They are predominantly immunoglobulin M type and they cannot cross the placenta during fetal life, and antigen A and B are not well developed at the birth, so that ABO incompatibilities rarely produce hemolytic disease of newborn. Stored blood is not suitable for transfusing WBCs and platelets to a recipients. Why? So stored blood is not suitable medium for transfusing WBC and platelets to a recipient because the blood stored for a longer than 24 hours contains virtually no viable WBC and platelets, so that stored blood is not suitable for transfusing WBC and platelets to recipients. The term universal donor and recipient are no longer valid. Why? As complication can be produced by the existence of the Rh and other factors, so that the term universal donor and universal recipients are no longer valid. Intravenous calcium gluconate is given with citrated blood transfusion. Why? So the answer is that with massive transfusion of the citrated blood, normal conversion of citrate to bicarbonate by the tissue cells may be delayed, so that the patient may suffer from the lack of ionized calcium. And most probably patients with the liver disease or induced hypothermia, so that because of the deficiency or lack of the ionized calcium they may suffer from tetany. And then alkalosis also develops in patients with a defective kidney function, so that the intravenous calcium gluconate is given with the citrated blood transfusion. Rh negative female at any age before menopause should not ever be given a Rh positive blood transfusion. Why? Now, if we give a Rh positive blood transfusion to Rh negative female, then she becomes sensitized by the injected Rh positive blood and forms anti-D antibodies, and she is likely to destroy subsequently any Rh positive fetus. In other words, the transfusion may make her permanently childless, so that Rh negative female at any age before the menopause should not ever be given a Rh positive blood transfusion. Purpura is known as purpura. Why? Purpura is a disorder characterized by prolonged bleeding time, but the clotting time is normal. Characteristic feature of this disease is spontaneous bleeding under the skin from the ruptured capillaries, and that causes a small tiny hemorrhagic spots in many areas of the body. And now these hemorrhagic spots under the skin that are called purpuric spot means purple colored patch like appearance, so that disease is known as purpura. After violent death, the blood becomes incoagulable. Why? So in violent death, the blood is fluid and incoagulable due to fibrinolysis, and this is due to large amount of the adrenaline that is released into the blood before the death. So the adrenaline causes a rapid release of plasminogen activator from the endothelial cells that causes massive fibrinolysis, so that after the violent death the blood becomes incoagulable. Blood transfusion should be given at slow rate. Why? If rapid transfusion is given, citrate present in the stored blood may cause chelation of the calcium ions that leads to decreased serum calcium level and that may leads to tetany. So that blood transfusion should be given at very slow rate. Increased incidence of tumor with advancing age. Why? Now, as the age increases, there is a decline in acquired cellular immunity, so that there is a increased incidence of tumor with advancing age. Platelet possess the property of adhesiveness. Now, following the injury, the platelets come in contact with the damaged collagen fibers and endothelial cells of vessel wall and change their characteristics. That is why they begin to swell and assume a irregular forms with large number of the pseudopodia protruding from their surface. Now the contractile proteins of the platelets that contract forcibly and cause a release of the granules that contain a multiple factors. Now the factors responsible for the adhesiveness are collagen, thrombin, ADP, thromboxane A2, calcium ion and the von Willebrand factor. Platelets become sticky and therefore adhere to the collagen of the damaged cell walls and to the damaged endothelium. Platelets have the property to aggregate or platelets stick to each other. Why? This is due to ADP and thromboxane A2. Platelet binding causes their activation which results in release of the contents of the granules. The released ADP acts on ADP receptor that are present on platelet membrane and that produces further accumulation of the platelets or platelet aggregation. Now platelet aggregation that is also forced by the platelet activating factor cytokines that are secreted by platelets, then neutrophil and monocytes. Now platelet activating factor that acts via a G protein couple receptor, GPCR, G protein couple receptor. And in human beings there are different types of the ADP receptor. Thank you.